let's get into it. Psych and P resources, and now we're talking digital resources. So in the first video, I talked about Stahl's prescribing guide, and that's a physical book that I keep on my desk at all times, but there are some apps and some digital resources as well, okay? So I have my notes here. So the first one is the Waco guide, W-A-C-O, and you can access it. I have my iPad here, but you can access it on your phone. You can have it on your desktop. You can, it has a website. So it's wacoguide.org, W-A-C-O guide.org. And this is what it's going to look like. So basically you just, you have to formulate your own diagnosis, of course, right? We're using our brain, we're using our resources. We're not relying on these, like I mentioned in my other one. I always have to preface it by saying, don't rely only on resources. You need to use your knowledge and your education. So you pick your diagnosis that you're thinking of. So we'll say bipolar disorder. If they're pediatric, adult, geriatric, so we'll say adult. If there's any special population like reproductive age, cardiac impairment, hepatic impairment, that kind of thing. So we'll just skip it. How is the patient currently presenting? Right now, let's say that they're manic. Okay, and it's going to give you options. Have they been on medication before? We're going to say no. And it's going to give you some recommendations, okay, and the medications that you may use in that specific patient. So that's a really good one. I like to have that one up on my computer as well. This one is SwitchRx.com. I'm not sure if this one actually has an app. I usually keep this one up just on my desktop when I'm at work. But this is if you're switching psychotropic medications. So this is what it looks like. And say they're on an antidepressant and you're wanting to switch it, they'll give you guidelines on how to do that. So switching Okay, so it made me log in. So say you want to switch antidepressants. So I clicked on antidepressants and they're going to ask you which one are you trying to switch from. I don't know if you guys can see that or not, but and say they're on, let's say escitalopram, Lexapro. It's going to say how long have they been on it. The last will say 4 to 8 weeks. What dose are they on? Or let's say 20 milligrams. And we want to switch them to fluoxetine, okay? Just for the purpose of this. It's going to ask you, why are you wanting to switch it, okay? Are they having no response, partial response, non-compliance, drug interaction? So we could say partial response. And then you're just going to click switch. And I know you guys can't really see it, but if you go on the website, you can play around with these. This one, you do have to create a login, but it's totally free. So is the Waco guide. You create a login just with your email, and it's free as well. Then it's going to tell you guidelines on switching. Simple as that. So switching from escitalopram, it's going to tell you decrease dose by 5 milligrams a day, increments at weekly intervals until drug is discontinued, okay? And then switching to fluoxetine, starting dose, usually dose is 20 milligrams, and then it also says a lower starting dose at 10 milligrams may be required. So it just kind of gives you more of a guideline, and it shows you how the overlap is going to do if you're going to do like a cross taper, if a cross taper is required, based on your specific patient. So the next one I want to talk about is Epocrates. So Epocrates does come in an app, and I've been using Epocrates for my FNP, for nursing school. It's an excellent app. There is a paid version, so on the free version you only get so much, but I think it's still worth it. You can do the app, or again, like I said, the website. This is what it's going to look like. And you're going to search. So when you have a medication, so it's basically like a medication guide too. So you can use Stahl's, or you can use this if you just want like a quick lookup. And Stahl's is available in a PDF too. I didn't mention that, but I like physical books. I'm a physical textbook girly, so but it is available in a PDF form. So let's just look up a medication. So let's do Lexapro, since we're on that one anyway. And this is what it's going to look like. These screens aren't very good. Okay. Oh, it's telling me to sign in. But basically, it's going to show you the adult dosing it's going to have the different conditions that you can use Lexapro for. So if you're prescribing for major depressive, if you're doing generalized anxiety, it'll give you the black box warning. So it's basically like a medication review, medication book, but on the app format. So I love that one. Then there's the ones that you probably already know about, like Uptodate, if you're looking for research articles that are based on evidence and actual research out there, scientific evidence on why you're doing medication or different clinical trials. Uptodate's an excellent resource. The next one that's specific to the SMI population, or seriously mentally ill population, which is the population I work with in community health, it's called the SMI Adviser, okay? And it is a whole resource for SMI population. And what's cool about it is that they have a free tool for mental health professionals to be able to consult with other specialists in mental health. So if you have a case and you're not sure and you need a collaboration, they offer a resource where you can actually contact them and they'll respond to you within 24 hours usually on, you know, advice and best practice for that case, which is excellent resource because if you work with that population, you know that a lot of them are highly complex. They're on many medications, and sometimes you just need a second opinion or to, you know, consult with someone who has more experience. So it's an excellent resource. They also have different guidelines and PDFs, especially if you're wanting to know more about like long-acting injectables, if your patients miss a dose, common side effects, that kind of thing. It's really specialized for that SMI population. So, and then finally, there's the Carlat Psychiatry podcast. If you are one that likes to listen to podcasts, they drop short episodes on like new evidence, new practices, new medications that are dropping out, and it's not funded by any pharmaceutical company, so they're completely like unbiased in what they're presenting, which I really love. And they have a ton of resources as well. I think every episode they're giving you resources that you can look at, and they also have a website, carlatpublishing.com. So these are just some of the digital resources, apps, and websites that I use in my practice as a psychiatric nurse practitioner. If you guys have any questions, or if you're a Psych NP or a Psych nurse and you have more resources, leave them down below, share them so we can get more information out there. And as always, appreciate you guys watching, and I hope you have a good day.